Hello, and welcome to our show, Conversation with Priya. Today, our guest is Tommi Pätilä. He's the co-founder of KOITE Health OY Finland. He is also an associate professor consultant in pediatric heart surgery and organ transplantation at HUS Helsinki. He has a demonstrated history of working in the medical device industry and is also skilled in healthcare, project management, clinical research, and business development. He completed his Doctor of Medicine from the University of Helsinki, specialized in cardiothoracic surgery. So help me to welcome today Mr. Tommi. Hey, Tommi. Thank you for joining in and welcome to my show, A Conversation with Priya. Thanks for your accepting my request for the interview.
Thanks, Priya. It's a pleasure. Thanks for having me.
Pleasure. So I know I have discussed with your colleague Sakari. He was actually explaining about how you guys are working on Lumoral product, and it's really creating a very good momentum in terms of oral hygiene and oral health. Would you like to explain in a brief that how this whole journey started?
I'm a pediatric cardiac surgeon, and I've been doing a lot of research about the heart failure, and revascularization of heart, and it started very early before I met even Sakari. We were doing research about stem cell transplantations and gene transfers for treating heart failure. And during those interventions, we used certain kind of an imaging method. And this is where we got the idea that if we use this certain kind of optical method,
right?
And here we found the interaction between the active substance and the light, and there's the start of the idea is very far behind, but we tested this antibacterial effect in the microbiological department of in Helsinki, Finland, and it seemed to work very well. And this was the start. And later I found a connection with Sakari, and that's the kind of the key point when it all started to run faster and smoothly.
More like a product launch, and that's where.
Yeah, more like a kind of a targeted idea that we could really use this for dentistry.
Yeah, very.
And that was, of course, because the action of the method was very strong against streptococcal species, and we all know that the Streptococcus mutans is the kind of key player in dental diseases. So
right. Very interesting. So people are already making New Year resolution, like it's already February, but saving money, eating better, or starting a new business. What, according to you, would be a New Year resolution for improving dental health point of view?
No, well, about dental health, the key issue is always the prevention and taking care of your oral hygiene the best you can, and that should be a minimum of brushing teeth twice a day and flossing every day. Unfortunately, not all the guys are doing that, and this is the kind of the key idea. And the New Year's resolution should be that these are done every day.
Yeah.
Not only the January, but and additionally to that, we can use other kind of methods, and Lumoral is probably one of the best of the other methods to be used in addition to this basic thing.
Yeah, very interesting. Because most of the time it's being taught in a very early age, when we are kids, parents teach us, but when, a lot of adults also not following this basic rule, which is like little surprising. But people should definitely at least follow the basic rule of their this kind of issue, which will solve the many problem. But I heard Lumoral is more about hygiene and also preventing gum disease, gingivitis, all those issues. So how it helps? Would you be able to explain the audience on this?
Can I? Could you please repeat the question? The last.
Yes, the question is that, like, I know this has been helped. The Lumoral is being used for
Yes.
more of a dental hygiene and dental health related, right? So it's how it helps on the gingivitic and mouth. I know these days it's a big issue is bad breath because of the mask people are mandated to use. So how it helps people to maintain the overall hygiene, especially in this current circumstances.
No, the main problem in oral hygiene is that every time you brush your teeth, you leave a residual plaque behind.
Yeah.
So it's not complete the normal toothbrushing. It's normally enough if it's done regularly, but it leaves behind some plaque.
Mm-hmm.
And this eventually develops to calculus in some patients or some people, and some people do not develop this tartar. But if we can attack that kind of the plaque we leave behind after the normal hygiene, that would be the change big change in oral preventive care.
Mm-hmm. Yeah.
We can work more with the kind of education that the people should brush more teeth. But what should we do with those who already brush their teeth for twice a day and floss, and those people who have problems despite they follow the orders and instructions? So there would be the kind of
very interesting, very important point you have mentioned here. But in terms of Lumoral product, I know it's been formulated after years of research, as you mentioned earlier as well, and developed a product very specific to hygiene. But there are a lot of products in the market which is more talking about whitening and all. Could you please explain how Lumoral products are uniquely different from other similar dental products available in the market?
Well, if we talk about the whitening products, they look the same. Lumoral method is doing. We have a technical mouth rinse that kind of attaches very strongly to the dental plaque.
Right.
And it's really doing nothing there unless you activate it with light. Mm-hmm. And with Lumoral, you can kind of by activating this mouth rinse, you can have a very, very effective antibacterial treatment right in the plaque, in the area of kind of microbial flora in mouth where you want to get rid of. You want to brush that away. And we leave all the other parts of the mouth untreated. So your own microbiome in mouth stays intact. Mm-hmm. And that's the kind of the key point compared to other kind of antibacterial solutions, which could be mouth rinses or such. But we can't really compare Lumoral to any whitening products, although they produce also some sort of antibacterial effect in the area, in the frontal.
So what I understand, whitening tool is more of a beauty product, I would say. It's more of a beauty product, and this is more of I would say it's more related to health. No compare
Yeah.
with whitening tools.
Yeah, yeah, you got it. You nailed it.
Yeah, so in that terms, that there is no competition for us in this product. Like there is nothing like this available in the market. What we are trying to introduce.
Yeah, that's pretty much the case. But I really believe that this kind of a treatment is coming, and we happen to be the first ones, but we won't be the last ones. And these kind of products will be the key to improve the oral hygiene at home, and it will be a big difference in general health all over the world.
Yeah, and I mean, I've been told last time when I was discussing with Sakari that it is gonna not only related to your oral health, it's gonna be improving overall health of your body, because there are a lot of health issue related to your oral health. It starts from there.
Yes, that's a key issue here. It's
Right.
not only of course it's very important to have oral health. It's affecting very much your kind of self-esteem and all kinds of things in addition to chewing, and but the correlation between oral diseases to general diseases such as heart diseases, chronic lung, kidney problems, rheumatoid arthritis. That's the key issue here.
Wow. So, going to the dentist for most kids happens every 6 months. I know you work in the more kids area, but as we grow older, many of us fail to follow through the regular visit. Blame it on the visit, like busy work schedule, a demanding social schedule, or lifestyle. As an oral health professional, what are your views on this? How people, like, it should prioritize. We all should prioritize on it, isn't it?
Yes, it's very important, and it's very interesting if we kind of compare different countries between each other. And for example, Germany, who has they have a very good general oral health, just like Danes, and they according to their instructions, you have to go to the dentist every half a year.
Ah.
And if you don't do that, so then your insurance payments will increase. So they really push you to go to dentist or hygienist regularly.
Wow.
And it's a key point here. And I really recommend using professionals.
In Australia, what we do, we've been, if I have private healthcare, it has been pushed. We have been reminded that there is a due, but there is no penalty for that.
Yeah, sometimes the penalty works.
Yeah.
But the penalty, of course, it's your own health, and that's the kind of a worse penalty, for, in my opinion, than the occasional payment.
Yeah. If you are not gonna do that, your internal body is gonna punish you anyway, sooner or later. So, yeah, but they say preventive dentist starts at home. How people can start doing at home, and I know this tool can help us to utilize home care.
Yeah. Do you mean how the product could be used?
The product is definitely gonna help you to prevent your dentistry start. Like, a lot of people say, oh, why can't you start from the home if you can't go visit doctor, if it is costly, if you don't have private healthcare. So you should start that. And I know I've been told that this product it's a start point. People can utilize this and maintain the basic health care, isn't it?
Yeah, no, yes, we have a lot of customer responses that those who develop a lot of calculus, for example, they haven't got any calculus at all after starting regular Lumoral use.
Wow.
So even those kind of hard calculus developers are kind of having for kind of zero data in the dental visits, and also the gum inflammation is going down, and we have reports from dentists that after few uses they have relief of kind of gum bleeding, which is not normal.
Wow.
It's not normal to have your gums bleed. So there's really an effect even in these kind of minor things, but the real effect shall be in the kind of prevention of periodontitis problems, these kind of problems with kind of the big issues. But of course, these big issues start from small problems, and the small problems are just general gingivitis, bleeding from gums, and these are the things that we should attack, and we can really kind of work with that with Lumoral product. It really
At least it will solve that kind of a problem at the beginning. And of course, it's not the substitute for the doctor, but it's definitely a good start point, I would say. Yeah.
Yeah. Yes. Of course.
Yeah.
And if there's kind of any kind of a problems that should be treated by a dentist, let's say developed tooth decay, or there's a active periodontitis where you have a plaque in your gum pockets, so those must be removed, of course, and then the Lumoral comes in addition to that. So
Sure. So in that case, this brings to my last question. Diabetes is a non-communicable disease that has affected millions world over. How does dental hygiene helps control the blood sugar level, or what is the connect between diabetes and dental health?
Well, diabetes is a big problem all over the body. It can affect practically all organs, and of course mouth is one of those, and we know that if you have a kind of inflammation in somewhere in your body, that's a kind of big issue with diabetes. And if you have a periodontitis, you actually can have a kind of the same area, like your hand is a kind of as an open wound in your mouth, and that's the kind of the issue where the inflammation in periodontitis is kind of deranging the sugar levels in diabetes. And of course, the diabetes itself, it kind of affects the healing of this kind of the big wound in your mouth, and it's kind of working two ways. And it's very important for diabetes patients to take care of their oral health, and of course, there also the main point is the regular hygiene. And if you need something more, then you can have something, but the oral hygiene is the kind of the key point. Brushing and flossing, and then something else.
Yeah. And of course, use Lumoral, which will actually help you to prevent, at least at the beginning. And regular visit to the doctor is always important for the diabetic patients.
Yes, of course. That's the key point. And usually the type 1 diabetic patients are a little bit younger, and type 2 diabetic is different. It's a different kind of disease, and type 2 diabetes is more related to the lifestyle, and not with everybody, but in many cases, and that can also kind of correlate to mouth health, but it's very important to keep healthy habits, and one of those is eating well and taking care of your oral health. Yeah.
So it's a definitely, when you are looking after your overall health, it's one of the criteria you should also check, and it is going to affect other part of your body and organs. So you have to be looking after it. Thank you so much for joining in. I'm pretty sure it will help our audience to understand, all that basic importance. And of course, I'm using it. So I'm really happy with this product. I can recommend on that. And it's really helping in many ways. Like, I'm feeling more hygienic, more clean. And, it's most of the people say that if you are a big coffee drinker and smoker and all, it also helps you. But I'm not a big coffee drinker and smoker, so I can't say on that, but people say it helps a lot. But definitely I'm using a lot mass, so it helps me on that sense. Thank you so much.
Okay. Thank you, Priya.
Thank you for your joining in.
Bye-bye.
Thank you so much for watching this video. If you liked it, like, comment, and subscribe if you haven't already done it. To know more about us, visit www.corporality.global. And also you can find more about Priya Mishra is on priya.sydney.